Well, it's certainly understandable that people going through a cancer diagnosis and treatment have feelings such as fear, worry, sadness. But unfortunately, sometimes these feelings become overwhelming and affect a person's daily life. And these symptoms can become more severe, such as leading to sleeplessness, anxiety or panic, or depression. And when these symptoms become overwhelming and are really negatively impacting a person's daily life and their ability to get through their treatment, that's certainly a sign that getting some help would be helpful. It's also important to realize that mental health can affect a person's physical symptoms, such as pain, fatigue, low appetite, and also their cognitive functioning, such as their ability to concentrate and their short-term memory. And when these symptoms become more problematic, that can be a sign also that their emotional distress needs to be addressed. Yeah, sometimes it is hard to tell, sometimes it's hard to tease apart, how much of their fatigue, how much of their low appetite or their sleeplessness is due to, the cancer treatment or their emotional, distress. And that's part of the conversation that we have with patients. That's part of the time that we spend with patients to try to tease that apart, to understand, how much of these problems are likely from the cancer treatment, for example, and how much might be due to depression or anxiety. And that's what we're trained to do. That's what we enjoy doing, and a lot of that takes a little time, to talk to a person to really be able to tease that apart. But that's what we're specialized to and trained to do. And people express their emotions, they express their stress in different ways. Some people come out and tell you that they're anxious or they're feeling depressed, and some people they express their stress in more physical symptoms, and some of that is cultural differences, some of that is just differences in upbringing, some of that is just personality, and we understand that everybody's different, and we try to help everybody, no matter how they express themselves, and we want to improve their quality of life. If you feel that someone close to you is struggling, it's often helpful to find a dedicated time and a comfortable place to sit down and just listen to them and to understand what they're going through, to tell them that you are there to help, to express your empathy and concern. And then if you have real concerns, then ask them if it's okay for you to share some of your observations and some of your concerns, and to reassure them that what they're going through is not unusual, that they're not alone in what they're going through. And if they're interested and willing to get some help, then try to be as specific as possible about how you might be able to help. Ask them how they would like you to help. And then if you do want to give them some ideas, be as specific as possible, such as maybe a referral to our services to help them with their stress level. How to start a conversation needs to be very individualized to the person, and it's best to kind of listen to what the person, how the person expresses their concerns and their symptoms, and then go with what they're telling you, and ask them, what are some of the things that you'd like to see get better, so what are some of the things that you'd like to see improve, and then go from there. Talk to them about, well, there might be some things that can help. I heard that at Hutch there are some people who specialize in these things that that can really help you get through these tough times. It's important to not, not force yourself on a person if they're not ready to talk about how they're doing. But if you're noticing some real concerns about their symptoms or their safety, certainly, then you need to, you need to be a little more assertive, about telling them that you're concerned in a very, as gentle a way as possible and as understanding a way as possible, and to get other people that they trust as well, to also help them and help them understand your concern.